everyone. Welcome back to the Advancing Healthcare Innovation Show. I'm your host, Michael Stamatinos. And if you're new to us, man, we're really excited to have you here. You know why? Because we're bringing some really incredible conversations with some leaders that are painstakingly trying to change the trajectory in the future of healthcare. We're really passionate about a few things. We're passionate about healthcare innovation, leadership, access, and adoption of these innovations. And if it's your first time tuning in, let me just kind of give you a quick rundown of what we're trying to do here. So we're focused on bringing real stories of innovation to life, not just the things that you read in headlines, but real things, real people that are getting stuff done. And the aim is to give them the space and the platform to be able to share their stories with our community, ultimately with the world. And if you hadn't had a chance to check out any of the historical interviews, wherever you are, just make sure that you hit the subscribe button so that any of the new interviews come directly to you. We've got an action-packed year, some amazing conversations that are lined up with some exceptional speakers. So stay tuned for that. So our field, it's constantly evolving, it's moving quickly, and it's pretty crucial to have leaders that are really envisioning the future of care differently, but they're also eagerly embracing innovation and leaning into a lot of these pressing challenges. And there are no shortages of challenges, which means that there are opportunities that can be taken advantage of. So we've got a leader that's coming on today that has spanned over 3.5 decades in various fields, accounting, real estate, marketing, banking, healthcare. Imagine if you took that person, brought them into this space, and they could kind of share their wisdom with you. That's about to happen. And I'm really excited for this leader to come on. So we've got David Sylvan, the Chief Strategy, Innovation, and Marketing Officer at University Hospitals. David really stands out for a few different reasons, but really his creative approaches to solving some of healthcare's toughest challenges. He's also the president of University Hospital Ventures, where he uses his leadership skills to really kind of discover and implement new healthcare solutions that are innovative and impactful. So his work, kind of tying it all together, is really around bringing different people together, ideas that can really improve health in ways that are smart, that also last long. So his ability to sort of think deeply about problems and connect with people on an emotional level has really made him a really brilliant leader. And I mean, I've only had a handful of conversations with him, admittedly, but you kind of get the sense, you can feel the energy. So he's known for tackling really big problems, and he's going to share with us today a little bit about how to kind of mix strategy and action into healthcare. So we'll learn about how sort of embracing technology, building a culture that loves new ideas, and while also being a good steward of resources to make healthcare better for everyone, whether it's patients and the people who work in it as well. So David, welcome to the show. It's great to see you.
Michael, excellent seeing you. And wow, that was a glowing introduction. I actually should have probably recorded it and played it for my family. So no, thank you for that. Excited to have a conversation with you. I've enjoyed our chats to date, and looking forward to what today can bring.
Yeah, so I mean, you've had a pretty awesome career, a few different tours of duty spanning across multiple disciplines. Can you maybe share an experience from earlier in your career that you kind of believe set the trajectory for where you are today?
Great, great. I knew you'd come out of the blocks with a challenging question. Without anything being rehearsed here, which I think is part of your ethos, which I think is great
Yeah.
from a modality perspective. The first thing that just came to mind was how I had coaching and mentoring to get me through failure. I was a terrible student. In fact, so legendarily bad that I was kicked out of college freshman year. I was expelled because I failed. And tail between the legs, embarrassed, guilty, began to go to night school, and I joined an accounting firm as an apprentice. So I continued my studies at night school, but worked during the day. And I had a very forward-thinking manager at that time at this accounting firm, which was a predecessor to Deloitte.
Mhm.
And she said to me, you know, you're not happy. And I can tell you're not happy because you're not fulfilled. You're not fulfilled because you didn't achieve what you set out to achieve scholastically and academically. And I'm going to encourage you to actually leave, to repetition the university to let you back in and to fulfill at least that threshold of what you think is a gap in your trajectory and your experience. I was already now making money. I was already somewhat independent. I certainly didn't want to show my face again back on campus for a variety of reasons. But she was right, Michael, and I think it was pivotal. I followed the advice. I carefully repetitioned to get reaccepted, which I was, and it was one of those nodes in life that took me in a completely different direction. Often we all experience things you wonder what would have been had you fill in the
Right,
blank, and
right.
this was one of those nodes.
Wow. Amazing, amazing story. You know, between some of the transitions that you've made, has there been sort of an underlying thread, a skill that has translated kind of universally across all the different niches and industries?
Yeah, I think it's the willingness and the ability, and it's a skill that you hone. I don't think it comes necessarily naturally to listen. We're all, it's ironic. We're sitting on in a conversation, which means impliedly we're speaking to each other. But I think from a leadership and a growth perspective, the ability to listen, to speak less, I think is both a critically missing skill for many, and it's also can be weaponized to your advantage. You can glean so much by purposefully and thoughtfully listening, not just hearing, but listening, and candidly only really contributing and speaking when it's accretive to the conversation or the outcome.
Hmm, interesting. Look, you're sitting in a really interesting seat today, in terms of being sort of at the forefront of innovation, university hospitals. When you're looking at potential projects or innovations to pursue, what's the what's a deal breaker for you? You know, something that immediately makes you say no.
Shiny object syndrome. We see the volume of great ideas that we see is almost debilitating. We've got to parse those down to the true underlying problem statement. Are you, in fact, is the tool or the technology or the solution, in fact, tackling a problem at scale, a real problem, and not a nice to have? So it's really that delineation between what's exciting and cool versus what's really tactically and practically potentially impactful, as well as that quotient of what is the speed to impact. And of course, things like return and all of those things are subcomponents thereof. But really, going from the unmet need to an outcome that you're looking to effectuate, which ones of the opportunities that we see can actually potentially achieve those.
Mm. You know, prior to kind of hitting this record, you know, we mentioned about noise, and there's been a change of administration at the time of this conversation, and that means there could be a lot of noise. I'm curious, what do you and your team view as signal, and what has your intention, and what has your focus, despite all the noise that's going around us? What is your intention and your focus?
Our intention and focus is to choose those areas that we can address through change and action. There are going to be pieces of legislation that candidly will be passengers. We're going to have to go along for the proverbial macro ride.
Mm,
We're certainly not going to be silent when it comes to purposefully and meaningfully engaging with legislators and both, locally here in Ohio, so that would be Columbus, or on the Hill in DC. Um, we're going to back everything that we attempt to tackle with fact and without emotion.
mhm,
But there are going to be things, Michael, where we're just going to have to go along for whatever the ride might be. Some of the potential implications are very, very potentially severe. We're seeing what's happening right now with elements of CMS, CDC and NIH, FDA going dark, candidly, because they're atrophy. They don't know what to do next. What might that imply from the perspective of innovation funding and discovery and all of the things that we know that we need to move as rapidly as possible around in order to get needed cures
Mm,
to patients? Um, there are other things that are more machinations of legislation and legality, 340B, for example, and other things that have a very, very material impact on our ability to deliver needed care to our patients, but at the stroke of the proverbial pen could disappear. So we're going to focus on the things that we know that we can impact. We see an assault on what's now being seen as pejorative, and that is equity and inclusion.
mhm.
Um, we're never going to deviate. We're never going to stray away from our relentless focus on creating access, equitable access
Hmm.
to our patient populations, especially those who are underrepresented or disenfranchised. Might we have to nuance the manner in which we articulate those efforts? Probably,
Yeah.
sadly. Are we going to deviate away from elements of women's health or gender care? No, we're not. But we're going to have to do so perhaps in a little bit more of a intentional manner from the perspective of how we articulate those actions, how we socialize those actions. So there's work to be done.
Yeah. Yeah. I mean, just even along those lines, when I think about university hospitals, it's steeped in tradition and trust. I mean, how do you innovate within an institution like that without alienating the past?
I think you honor the past when you innovate. I think the bedrock of our existence for 160 years has been innovation. It might not have been deemed and termed specifically with that labeling, but when I look at the history of our system and I look at what was, in quotes, invented here, so to speak, I think to stall or cease or to moderate the pace with which we're attempting to innovate right now would actually do a disservice to our legacy and our history. And fortunately, it's become inculcated within sort of legacy and memory in the DNA here that we are an innovative organization. Not everything is a straight line between A and B. Um, the elements of people and personality and resourcing always comes into play, but we're staying the course when it comes to innovation.
Mm. And how big's the team? I mean, how well entrenched are they with operators? I think there's been, at least from my perspective, there's sort of two schools that I see. There are innovation teams that kind of sit outside,
Yep.
and then there are teams that are really entrenched, embedded, working hand in hand with their operating partners to try to make things work. What's the style that you and the team have sort of adopted?
Yeah, we did a lot of pre-analysis when we were forming the team. We did a lot of we parsed a lot of the SG2 work and others, and those constructs that you're talking about, and the variances between those are well documented. And what works in one place may candidly not work elsewhere. We chose the pathway to be truly embedded. We had, for example, just from a physical space perspective, had the optionality early on to think about a shiny basement with beanbags and Labradors and ping pong tables. And we realized that would really not only optically and physically have us remote from what we're trying to solve for, but would also not send the signal that we're actually part of a unified team. And so we are embedded within the system, both physically as well as functionally. So not only do we have and we're just talking about the innovation platform at this point, not strategy and the other sub
Yeah.
elements of my focus. But from an innovation standpoint, we have folks that congregate when they can at our main campus, the Academic Medical Center. And then we've embedded functionaries in other either clinical domains or physical hospital spaces around the system so that we have real-time tentacles, antennas, if you will, in all of those areas. Um, You can formalize the process of solicitation when it comes to innovation, a call to ideas, etc. Those are great. You have to do those.
Mhm.
You can also stand at the proverbial water cooler and listen to problems or spectate problems, and that spawns its own set of opportunities. And so a little bit more fluid, a little bit more organic.
Hmm. And when you can kind of be the tentacles and listen in on some of those conversations, is there a methodology that you've created processes around to intake those problems, to prioritize them, to bucket them to the degree that you're able to? Obviously, we're not asking you to share any sort of IP or anything of that nature, but to what you can share, would you mind kind of even
Well,
going into that?
absolutely. We are our core ethos is human-centered design. Impliedly, that would drive us towards observation and towards understanding the journey of and towards listening, attentive and active listening. Um, the notion of how we think about engagement, not merely from the standpoint of what might a nice idea be, but understanding that with limited resourcing, you also have to map back against strategic imperatives. There could be a wonderful idea that just isn't important to the system, probably a wonderful idea in another domain. We just don't have the discretion or the resourcing or the time bandwidth to tackle that. So it's multifactorial. We use a pretty sophisticated CRM with a wonderful tagging mechanism. We ensure that there is a degree of affinity and alignment with the strategic imperative. Secondly, we have to determine that there is an internal stakeholder or SME or champion who can, feed,
Hmm.
house, and nurture the opportunity once it's brought indoors, so to speak. And then we also play the role of ensuring that there's enough gel and continuity when it comes to some of the sub-elements like what does the agreement look like? What do measurables look like? What is success? At what point do we jettison because it might fail? So there is a process that we've built to down select from hundreds and hundreds of opportunities a year, external as well as internally sourced, to down select to those few that actually do have an identifiable disposition pathway. And we still won't bat 1,000, but at least we've
Right.
put ourselves in a position where we attempt to de-risk our own decisioning as much as possible by using discipline.
Absolutely. And when I think about it, when the choices that you and the team are making, I mean, lives are at stake. I
Yeah,
mean, because ultimately, your work impacts many lives.
that's right.
Uh, can you share even just like a personal story or encounter that really brought home the impact of your work or the team's work?
There are many. Let me at a very high level describe a technology that we spun out of university hospitals. And the
Okay.
genesis of the idea was a problem that was vexing. When an expectant mother is in the system and she's in labor and delivery, of course, we're talking about two patients, sometimes more, but invariably we're talking
Hmm.
about two patients,
Hmm.
mother and child. Standard of care in many respects is this episodic assessment of state, temperature and pulse and blood pressure. I'm not a clinician, Michael, so
Yeah.
please don't hold me to what I'm describing from a technical perspective. But there are points in time where there's an assessment made on the condition of mother and child. As you well know, as the audience well knows, there are sometimes bad outcomes. Those always go through a post-event analysis to understand what happened. What could we have done differently? Was it circumstantial? Was there an implication where we could
Right.
have intervened in a different way? And the
Hmm.
phrase that kept on coming up was, had we only known, dot, dot, dot.
Hmm.
Well, the a clinician, an individual within IT, an innovator, and a nurse decided to come together to codify and create a two-dimensional and paper-based algorithm around how could we obviate the had we only known, and was seriously a function of continuous monitoring of mother and child. Now,
Mm.
subsequently, that's been digitized. It's a company's been formed and spun out. And because of this continuous assessment, think about I'll keep it simplistic. Blood pressure time one is perfect. It spikes and something really, really is happening between point A and point B. By the time we get to point B, for whatever reason, blood pressure is normalized. Ordinarily, that might look like there's nothing going on. This algorithm is actually either predicting, preempting, or signaling something is happening between what traditional standard of care might imply when it comes to the measurement of vitals.
Mm.
As a result, our incidence of adverse outcomes for a good 3 or 4 year period, and we deliver thousands of babies a year, went to zero. Now, not only did that save lives,
Zero?
change lives, tactically, it also had a financial impact as well because of the financial burden for the families, for the system, for risk
Mm.
reserve. All of those things were positively impacted. Again, I've used the phrase before. We're never going to bat 1,000, but to the extent that our team can be part of introducing a tool or technology or giving life to an offering that changes lives, wow, incredibly humbling, especially as non-clinicians. It's an incredibly
That
powerful thing.
that's amazing to see that circumstance that was then escalated, processes put in place, get to the point where you can commercialize it and have others that are benefiting from it. Amazing. Oftentimes, people think about innovation, they think about expensive,
Mm.
costs a lot of money. Is there any truth in um, having innovation that occurs within resource, having constraints and resources? And do you think that's a good thing in some cases, or do you feel like it's better when you just throw lots of resources at it? Well, talk to me about that.
The best innovations had no ability to spend recklessly or without constraint. When you are limited by what you have, think was it Apollo 13 or Apollo 11? I can't remember which Apollo it was. When you think about the limited resourcing associated with problem solving in that scenario, it really forces you to make very tight, defensible decisions within a confined period of time. It's constraint and limitation is actually very, very powerful because the corollary puts you in this hubris position where you've got unlimited time and unlimited resources, and so you can play around with different modalities and pathways, and but you never get to an endpoint because you're not holding yourself to a constraint. There are exceptions, of course. Wonderful to have unlimited resources and the discipline to know what to get to from the next milestone standpoint. Most opportunities don't have that
Mm,
discretion. You know,
right.
we're hearing about a $500 billion AI moonshot opportunity right now, which is already under fire from the perspective of, well, how realistic is that? So unlimited resourcing, I think, can ironically be an anchor, whereas the discipline of limited resources can be used as a strength.
Yeah, I've always seen that even just growing up, sometimes something that could be a disadvantage early on can be an advantage later on, versus something that's advantageous could be disadvantageous, later on as well.
Right.
I want to pause for a second because we have something that most wouldn't know. We have a common bond, and outside of when you're not innovating within care, you're thinking about not on the day to day. Where do you go to recharge and find inspiration for your work?
Yeah, you're steering the witness, and I'll reveal what Michael's talking about here in a second. You know, the antidote for the day in the life of you and me is we're surrounded by tools and technologies, we're surrounded by sophistication, we're surrounded by bricks and mortar. Um, we don't necessarily have a chance to exhale. And as you're well aware, one of my primary foci for me is to candidly exhale on a small Greek island in the Eastern Aegean known as Chios. It just so happens that that's where your family's from, which is quite
That's
incredible,
right.
given that there's 19 people living on this island. I thought I'd found the only remote place in the world. But a close friend of mine, also a Michael, Augustinus is his last name. Uh, that's where he comes from, and I used to visit him on his island. And one day he said to me, "I have all of these olives. I don't know what to do with these olive groves. What to do with?" And we jokingly said it was probably alcohol induced. We jokingly said, "Well, why don't we make olive oil? Because we know nothing about that. Why would we not put ourselves out there?" Subsequently, we've begun to actually grow, harvest, process, bottle, label, and distribute our own olive oil that comes from this distinct part of your world, Michael. The olives there only grow on that island. They can only be made for olive oil. And I go and I physically do the harvest. There's no cell service. There is no Wi-Fi unless you're in the platea. You're forced to have to work very hard from very early in the morning till the light fades because there's no synthetic source of light. And the authenticity of having your hands in the soil, of being with people where you share no common language. I do not speak Greek, unfortunately. Many don't speak English. And yet we can spend weeks together and communicate perfectly through the commonality of food and music and ouzo and wine and laughter and dance. And it's the most rejuvenating thing that I can do. And I wish I could do it more often. And I think I have my sights set on what post-career looks like in that regard. So thank you for asking that question.
I asked that question because I'm wondering that level of connectivity, the bond that's created, how replicatable is that within your day-to-day environment? And what lessons can you draw from that? That's what
Yeah.
kind of is percolating in my mind.
Fascinating question. Thinking while standing on one foot, I would say to you, it forces, it should force individuals to find commonality when that commonality might not be self-evident. Our differences can be used as weapons to keep us separate, distinct, and apart. Those differences can also be an attraction mechanism and a glue. I talked about listening earlier. Well, listening and experiencing are aligned cousins, if you will. And if you're willing to listen and live the experience of the other and not fear the other, I think the power of that um, uh, informal collaboration is just infectious. And I think the crosswalk from that truly hands in the dirt to what hands in the dirt in a professional sense might
Mhm.
imply is that willingness to work with someone or some entity that doesn't quite fit the traditional crosshairs of what you would ordinarily do. And I think there's power to be had in that.
Nailed it. Nailed that question. All right, we're going to switch gears a little bit. I want to go to a section now. I'm going to call it innovation on the spot. So we're going to take a breather from some of these deep dive questions, and I want to hit you with some rapid fire questions, short answers, and I want you to sort of share the first thing that comes to your mind. Ready?
Ready?
Okay, let's go. Most overrated healthcare buzzword.
That's wow. There are a few. You know, access actually annoys me. It's such
Mm,
a critical subcomponent of what should pervade every day of our existence, but it's seen as a standalone activity. And I feel that access should, this notion of availability and experience should just be part of an umbrella welcoming moment. So I get a little bit annoyed when if people talk about solving for access. It's the
okay,
totality of what we're trying to achieve for.
right on. If you had to scrap every tech tool and just keep one, what stays?
I'm going to go out on a limb here because I'm getting so excited by what we're beginning to experience. Now, there is an underbelly to it, but what we're beginning to experience with AI, I think continuing to nurture the appropriate and safe evolution of that tool set, I think is going to be transformative.
Mm. Two more. You're stuck on a deserted island with one healthcare tool, and only one. What is it?
I think this is going to sound strange, and you're going to say I'm capitulating on the answer here, Michael, but it is the accumulation of knowledge. Healthcare is predicated upon uh, being able to stand on the shoulders of predecessors from the perspective of learning and growth and evolution. And so the healthcare tool that keeps us viable and will keep us forward focused is this accumulation of knowledge.
Mm. What's harder, creating the idea or selling the idea?
Selling the idea without any question. This notion of transcending the desktop exercise or the back of the envelope scratch into something that is in fact um, sufficiently attractive to someone who is willing to adopt and purchase. I think the selling is far more difficult.
Okay. Um, Before we kind of wrap up here, just sort of share with the audience maybe a little bit of a 60-second commercial around university,
Sure.
hospitals, and some of the things that you guys are doing, and just how they can follow your work, how they can follow what UH is doing. Take it
I
away.
appreciate the ask. We're situated in Cleveland, Ohio. We're an academic medical center, but we boast everything from rural and community all the way to tertiary, quaternary, and academic. We boast 3,500 ongoing clinical trials at any point in time. We're very active in the space. We have world-renowned clinicians and leaders, and we attempt to socialize our activities in the traditional spaces. So LinkedIn would be a wonderful way to follow us. We have a Facebook presence, both from a macro system perspective as well as a departmental service line. And Ventures, of course, has its own persona on LinkedIn as well. And we'd love you to follow us and double click on anything that you find interesting, reach out, and we'd be happy to engage.
Awesome. And then just one last thing, for those that are listening, if there is innovating, for me, the best innovators are the best executors. They have got a bias towards taking action. If there's one action that someone can take from this conversation, what would you like that to be?
Um, I'm living proof that you don't have to be steeped academically or experientially in a particular domain to have an ability to make a difference. And I would say to people, don't be fearful of what you think you're not necessarily formally trained in. Knowledge is fungible, it's stackable. Put yourself in a position where you're willing to take some personal risk. Be humble about what you don't know and surround yourself with people who might. But don't find yourself trapped within a lane line and a domain because you don't feel you have the capacity or the ability to stretch beyond that.
David, as you had mentioned earlier about that one mentor that had, I'll just say, injected you with the belief to go back and do something. I think this is exactly what this conversation might do for someone else, where they're contemplating something. And sometimes that's what these conversations can do. They can inject someone with that little bit of belief so that they can take that next step. So I just want to say thanks for coming on today. It was really great. And for those that have tuned in, if you found this conversation to be helpful, which I hope you do think it was helpful because it's been very helpful for me, would you mind sharing it, commenting on it? Let us know what stood out to you. But yeah, David, it's great to see you. Happy to have you come on again. And at some point, I'm probably going to have to end up joining you during the olive harvest at some point. So
Excellent.
thanks again.
Appreciate you having me. Thank you so much to everyone.